Hey guys, so this is my next video update after my 4th chemotherapy session. This time we've got the second instalment of drugs, my first Taxotere. Now this is given through a drip rather than into your vein with injections, and you basically sit there for about an hour and a half as the drip goes in, and you're given the drugs intravenously that way. This time there wasn't any immediate reaction to this drug, no feeling in my sinuses. I felt fine. I went home, enjoyed my weekend, was thinking that I wasn't going to have any side effects, but then on the Monday, 3 days after the chemotherapy session, I had intense muscle aches all over my body, up my neck, my back, my shoulders, my legs, almost like growing pains. So I had a tough week last week. From Monday to Thursday I was in quite a lot of pain. Monday I tried to sort of shake it off. I went swimming, but that didn't help. In terms of anti-sickness on this drug Taxotere, you take steroids the day before, the day of and the day after to prevent allergic reaction to the drug. I didn't have any signs of allergic reaction or any sickness at all, just the muscle aches, and I found that I had a sore throat as well, which sort of led me to believe that I might possibly picked up a virus from somewhere, and as you know, this is quite dangerous to do when you're on chemo, because if you get an infection, your temperature starts to rise, then you do have to go to A&E. So I lasted out until Friday, and then I spoke to my oncologist and she said that I should go for a blood test to check my white blood cell levels. Now I did this, and the test came back and it said that my white blood cells were very low, bordering upon neutropenic, which is a lack of immune system. Now obviously there's a procedure in place for this for people that are on chemo, and that procedure is to be placed in a room in hospital, which I'm not allowed to go out of, you know, basically imprisoned, and I called it my little prison. For 4 days I was in hospital, from Friday evening until Tuesday morning, or Monday evening, Tuesday morning, one of the two. I was allowed to come out again. Now what happened when I was in hospital was that I was given antibiotics intravenously 3 times a day, morning, afternoon and late evening. They did a blood test Monday and they saw that the levels were back up again, so they allowed me to come out. But it wasn't the best of times, but it's what you have to do, because if you leave a temperature or an infection without going to check your white blood cells or without receiving antibiotics, it could go bad quickly. So without thinking, oh I really don't want to go to hospital, I'm going to leave it, you have to be really careful and sensible about that. So genetic testing results, I got those last Friday, and I do not have the breast cancer gene, which is good news, because, you know, I don't have an increased risk of reoccurrence in my left breast or my right breast. There's also no obvious reason or chance that I should get ovarian cancer, and also this means that my oncologist is veering away from a mastectomy, and to do a small operation, which is just removal of the lump. Yeah, so that was good news. On the other hand, obviously there's still anxiety. If I do have a small operation, I feel that maybe, you know, it might come back, things like that, but they're questions that I need to address with my oncologist. Also, my Just Giving site, which is a charity that I've set up online for Teenage Cancer Trust, which is supporting the September the 10th gig at the Corn Exchange in Hertford. The money I've raised so far is £400. Now I really want to raise 500 by the end of this week, so I've got a good solid amount to put towards the gig. I know in my mind that we're on our way. My website, if anyone would like to donate towards this worthy cause, is www.justgiving.com/Katie with an IE dash Huttlestone. Huttle, Stone. Obviously I'd be really grateful for anything that you can give, because obviously it's a cause close to my heart, young people affected with cancer, because I am young, even though I'm not in the age bracket of young. I'm still young, I'm 21. So yeah, I really want to raise as much money if that's possible. In terms of how I feel now, I feel much better. I've just been up into the gym because they say that 2 hours a week at least of exercise for people on chemotherapy is favourable and it helps with your recovery. So I'm really trying to do that whenever I can. Yeah, so apart from the hospitalisation, the obvious neutropenic state that I was in, I'm doing okay today, and I'm hoping for a good week and a half before my next chemo. So yeah, thanks for listening.